Thank you for waiting and welcome to everyone. It's Dr. Eduardo again, Senior Attendant Physician at World Stem Cells Clinic and rehealth Clinic. I hope everybody is doing well and watching us from home. Um, and today's lecture will be about the therapeutic potential of the mesenchymal stem cells and regenerative medicine for longevity and anti-aging. First of all, it's important to understand what is the process of aging and what happens during this process of aging. As we age, our cells will get sick and will die eventually. But when cells die, it creates a cascade of events that will lead into inflammation. And this inflammation may cause some other symptoms or trigger some other diseases that can decrease the human lifespan. But before getting started, let me tell you a little bit about who we are. And we are World Stem Cells Clinic again, and Rehealth Clinic. We are an American company, and we offer our therapies in Paradise here in Cancun, Mexico. Our mission as a company is to share and apply our experience with the use of stem cells and cell-derived products as adjuvants in the treatment of different diseases. Now, we also own our blood bank and our stem cell bank, as well as a cord blood tissue bank. And we provide several therapies with the use of regenerative medicine, mainly the use of the mesenchymal stem cells. We treat, for example, conditions such as Crohn's disease, multiple sclerosis, lupus, juvenile and rheumatoid arthritis, COPD, arthrosis, osteoarthrosis as well, Parkinson's, diabetes, and ortho and orthosports injuries, strokes, and well, so much more. If you are interested in learning more about the use of stem cells in a specific condition, or you have any doubts if we treat any autoimmune conditions or any disease at all, please feel free to send us an email, write us a message, and I'll be happy to reply as soon as possible to your doubts. Now, the objectives of today's lecture, number one, will be is for you to hear about us. Now, you know that we are here, we're in Mexico, we're ready to help. We again own our own blood bank and stem cell bank. We will be discussing what's aging and what's the progression of aging and how does it happen. We will also discuss the definition of the mesenchymal stem cells and their use in the regenerative therapies. Also, we will go through some clinical investigations and the therapeutic potential of the stem cells with anti-aging purposes. Regarding our processes and affiliations, even though we're in Mexico, we follow all of the regulations from American FDA. We are actually certified by FDA for good manufacturing practice and good tissue practice. We are also certified by International Standard Organization 7 for our laboratory, for our lab, which is built under clean room standard. And we follow all of the regulations, of course, from the Mexican FDA, which is COVID-free. We are now affiliated to ReStem Company, which is a company offering stem cell therapies for patients undergoing COVID infections, mainly in patients who are affected with moderate to severe infection of COVID. ReStem is treating these patients in Hospital of Miami in South Dakota. Now, let's get started. What is aging and what does it happen? Aging is the result of two overlapping processes, one intrinsic and one extrinsic. The intrinsic is the structural changes that occur because of physiological aging and is genetically determined. The extrinsic, on the other hand, relates to the exposure to harmful events or habits such as smoking, heavy drinking, not sleeping properly, you name it, okay, not eating properly, and stress, exposure to the sun, environmental pollution, etc. Aging might be decelerated by improving bad habits such as quit smoking, quit drinking, or at least reducing the amount of ingestion of alcohol or some other environmental factors. Um, by improving these bad habits or treating signs of aging with good supplements, for example, such as antioxidants or the use of stem cells, we can increase the lifespan. It is believed that we cannot stop the process of aging, of course, entirely because the extrinsic part of aging, which leads to irreversible cell damage, as well as tissue and organ damage. Organs, it's hard to renew themselves because they're limited capability of doing so. That's the point of using exogenous stem cells. Stem cells can also promote the regeneration of aged tissue and organs by replacing the damaged areas and replacing apoptotic and necrotic cells with healthy ones. In addition, these cells, they have anti-inflammatory and anti-apoptotic properties. By pancreatic secretion of growth factors and cytokines on the side of the administration, we will also see improvements in the organs where receiving the stem cells. These make them very useful, for example, in treating patients with osteoarthritis or arthrosis, because with the onset of years and wisdom, there starts a process of chemical modifications that will be occurring in your DNA. And by choosing an active lifestyle or decreasing harmful environmental factors, this, along with stem cell therapy, aging can be significantly delayed, which is the point again of the use of stem cells. Now, we can also implement some dieting plans and making the best we can, or best effort to have a good quality of life while growing old, such as dietary restrictions, for example, which promote longevity in many species, and also delays the delays aging at the genetic level by stabilizing telomerase activity. The effects of caloric restriction counteract the effect of oxidation, inflammation, detoxification, and telomerase activity, and decreasing stress and damage to genes. So it's good if you're following a diet, or if you suffer of extra weight. Well, always a good restriction of caloric intake could be a good point to start with. Now, if you're wondering what are the signs of aging, here you have 10. Impaired vision, impaired hearing, loss of strength in muscles, loss of bone density, decreased immune system, functionality, decreased cognitive ability, meaning brain fog, for example, less efficient metabolism, loss of energy, and decreased balance and overall mobility. But what do we know about aging? We know that your body is made up of millions and millions and millions of cells. And you also have millions and millions of stem cells on your body already since the time that you were born. But as you age, those cells will lose the ability to regenerate and to repair themselves, which causes your body to change and to age. Example, the quality of your skin will become thinner, you will lose elasticity, and it will cause eventually to have some wrinkles. Your bones can get weaker, and later on you can develop osteopenia or osteoporosis. And this happens because the amount of cells that you have since you were born will eventually start to fade away, and there will be an impairment. The process of oxidation, the release of free radicals, and affections to the organs, the damage to the organs, will reach the point where the stem cells that you already have in your body will not be enough to help the healing, and this starts the process of aging. And let's understand a little bit the language of aging. Uh, Aging is a balance between breaking down of tissue and rebuilding it with the use of stem cells. It can be either the stem cells again that you have since you were born, or exogenous stem cells, which is the point where we're doing this lecture, because of providing exogenous cells might help stopping the progression of aging and giving a better quality of life. According to one theory, the stem cells from bone marrow will go into tissue and become cells of that tissue. So meaning that the cells will go to the damaged area and will start a process of differentiation. This process happens every day, but the magnitude of the damage in aging usually is bigger than the capacity of the stem cells to rebuild, which was what I was just trying to explain in the previous slide. If the power of oxidation, release of free radicals, and tissue breakdown is bigger again than the rebuild abilities of the stem cells, this leads to aging. But otherwise, the healing effects of the mesenchymal stem cells is important to understand that are due to their secretory cytokines and the growth factors that they release in response to the specific injury or affection to the organ or the body. Additionally, the stem cells will communicate with local tissues and direct their reserve cells and mediators to coordinate and control the damage and help repair it. It has been described that stem cells become the regenerative portion of the residing tissue, but otherwise the healing effects are again because of the cytokines released, the growth factors released, the inflammatory signals, and other mediators for communication between the damaged tissue and the healing cells. This communication will not be limited to one another and with other cells, but it also extends to neighbor cells or neighbor tissues or organs, and even to the entire body. That's why if you have general affection because of aging, we will provide our protocol just by IVs, some IV infusions depending the condition. Some IV reinfusions of stem cells. If there's cognitive impairment, brain fog, or neural affection, we will also provide the intrathecal approach, which is just a fancy word for saying that we will provide a reinfusion of the mesenchymal stem cells through a lumbar tract. That way, the cells will be in direct contact with the central nervous system, floating in the whole cerebral spinal fluid and helping us again reducing the inflammation and repairing the damaged areas in the specific tissues. The underlying regulation of inflammation with mesenchymal stem cells comes from mesenchymal stem cells are well known to modify their cytokine output based on what is needed at the time. So the cell will know specifically what to do, when and why, and how they will also mediate the response to the affection, of course. Let's say in simple words, the cytokine output from the stem cells will release the specific cytokines needed in the specific amount needed, and this will help neutralize the inflammation and how to regulate the anti-inflammatory response to modulate the best way the effective communication in between cells. This communication can happen because of a small tiny little vesicles called exosomes, for example, or through these canals in direct contact between cells, or also by the soluble mediators and the already mentioned cytokines and chemokines. However, this communication system, the one I represent here in this picture, in this slide, will weaken, and with the onset of years, of course, with the increasing age, and further will accelerate the aging process because it will not work properly. That's again the reason why we offer the stem cell therapy. So at the end, the important part here to understand is that mesenchymal stem cells potentially act through cell-to-cell contact with mitochondrial transfer through secretion through this tube or canal that will be forming between cells, either directly in their forms of secreted liposoluble mediators or in exosomes, including growth factors and anti-inflammatory cytokines and chemokines, and thereby improving the tissue homeostasis and communication by favoring repair and controlling inflammatory response the best possible way. Now, there's a bunch of genes involved in the process of aging. One of the most well-studied and well-known is the Clotho gene. This gene is being proved to be related to the extension of life in many animal models. And Clotho gene has also been identified as an age-suppressing gene. Clotho overexpression heavily influences the process of proliferation, oxidation, senescence, autophagy, and modulation of insulin, as well as TGF-beta, which is a growing factor protein, and WNT, which is the signaling pathway that will be activated. Clotho deficiency is activated WNT expression, and this will contribute to the senescence and depletion of stem cells, which consequently triggers tissue atrophy and fibrosis. Clotho deficiency accelerates cardiovascular damage, impairs endothelial function, and fades vasoendothelium, fades vasodilation, dwindles angiogenesis, changes cellular calcium homeostasis, and disturbs the bone matrix structure that eventually results in premature aging. Now, stem cells are not the only substances that entirely control the course of life. I just mentioned that there's a lot of factors involved, like the exogenous factors such as the toxins and genes like Clotho. But other compounds, especially genetic factors, also play a substantial role to keep the fountain of life constantly with aging. But stem cells, together with anti-aging genes such as the Clotho gene that we mentioned, play a crucial role in delaying the aging process, as has been reviewed robustly in stem cell studies that state that stem cells can modulate the expression of these genes. Some aging contributing factors. Now, the stem cell depletion occurs with increasing age. Moreover, when stem cells divide, their telomerase shorten, and the stem cells will stop dividing and die. And this telomerase shortening has been reported to cause severe impairment of stem cell mobilization and higher genomic instability, and is correlated with decreased longevity and in various organisms. Now, short telomerase increase the likelihood of cells becoming old and producing pro-inflammatory molecules, which is a huge risk factor for age-related disease, of course. Many genes are involved in the determination of destiny of lifespan, and genes play a subsequent role in the longevity of life by altering their secretion of important growth factors, the cytokines, and the enzymes. Stem cells have the ability also to activate telomerase and regulate the length of the telomerase. This will favor the fact that these cells can divide again and multiply into new healthy cells, which is what we are aiming for. Mesenchymal stem cells target a specific tissue because they require the right combination of signaling molecules from the injured tissue to the corresponding receptors. So every time I get to hear, or pretty often I get to hear questions from the patients asking me how the cells will know what to do or how to help my body. Well, this here is the response. There's markers of inflammation, and which will be calling, for saying so, the cells, and calling cells to attach and start this process of healing by creating the appropriate environment to reduce the inflammation and control the autoimmune response, and at the same time sending signaling to the continuous the cells. So how can stem cells treat aging? Stem cells can exhibit numerous anti-inflammatory effects by migrating to sites of injury, disease, or inflammation. We suggest that our stem cells applied through an IV infusion increase the rejuvenation and keep in balance the expression of anti-aging genes, such as CLOTA, for example, that could delay the aging phenotypes and result in a prolonged lifestyle. Stem cells act as a repair system for the body and rejuvenate the replace aging cells to maintain health. The mesenchymal stem cells derived from cord tissue, for example, are the youngest cells that we can find with vibrant adult mesenchymal stem cells available in market. And those stem cells, the cells obtained from cord tissue, are the ones that we use. The donated umbilical cords are tested rigorously for infection agents, for genetic predisposition, for their probably medical history, you name it. They have perfectly been tested for everything in order to be provided as a therapy. Now, the stem cell therapy by its own is it's completely it cannot trigger an allergic reaction. They are immunoprivileged. What do I mean with immunoprivileged? That by their own, if they are not mixed with anything else, they will never trigger an allergic response. They actually will mediate any inflammatory response. The thing here will be if the cells come from a donor, like whenever the cells come from a bank or a cord tissue, we need to provide a pre-medication to the patient with some antihistaminics to avoid any type of reactions, not to the cells specifically, but in order to have them ready for you, we have to expose them into some growing factors, glucose, and some special media, and some antibiotics as well to avoid the growth of any type of bacteria, and just to avoid any type of response from your body to the media where the cells were growth, even though we cleaned them several times before providing to you as a therapy. We rather follow our protocol, providing this pre-medication just to skip or to avoid any type of bad reactions. And so far in our clinic, we have never had a single case of a complication in our patients receiving stem cells with any purpose. Now, how stem cell therapy reduces inflammation at a cellular level? Mesenchymal stem cells can influence the process of white blood cells. A macrophage is a large white blood cell that is an integral part of our immune system. Now, there are different types of macrophages. Macrophages are the type of blood cells that removes infectious agents, for example, and dead cells from your body. They come from, again, the white blood cell lineage, and they can create inflammation, depending if they are type 1 macrophage or type 2 macrophages, which does the completely opposite side effect. What am I trying to say here is that Macrophages type 1 or M1 macrophages are associated with accelerated aging, and M2 macrophages are associated with anti-aging. So the work here of mesenchymal stem cells will be shifting from M1 to M2 macrophages, and they are therefore giving the human body enough tools or more tools to combat the natural process of aging, and at the same time helping the reduction of inflammation, which consequently is delaying or stopping the progression of aging. Stem cells can maintain mitochondrial health. What do I mean here? Mitochondria are the power, what gives power to the cells in your body. Stem cell also maintain mitochondrial health by intracellular communication through tunneling or nanotubes. These tunnels that you can also see from the slide, previous slide, these tunnels, through those tunnels, the mitochondria will be transferred from a mesenchymal stem cell to a damaged cell with an impairment of their mitochondrial status, or with to unhealthy cells. And the stem cell therapy for anti-aging. Aging cells can contribute to disease. Thus, if cell aging can be prevented, slowed down, or even reversed, many diseases could be better managed. The stem cell may have the ability to slow the process down and combat certain age-related conditions. Now we have talked about the use of stem cells in the anti-aging purposes, but I haven't explained yet what is a stem cell. And a stem cell or mesenchymal stem cells are adult cells that are isolated from different sources that can come from different sources from the body, different parts of the body. They can come either from bone marrow, from adipose tissue, from Wharton's jelly, from cord tissue, or from amniotic fluid, you name it. There's several sources of them. And the cells that, of course, we use come from cord tissue, from a layer covering Wharton's jelly, and that's where we obtain the youngest and most primitive mesenchymal stem cells available. And the one we use for this therapy. The stem cells can have the unique ability to change into any cell in the body. And this process is called differentiation. That's why they have a pluripotential of again turning into pretty much any cell within the body. And the good side of this is that it's not a quite invasive procedure. We can administer just by an IV, and in some cases IV followed by an intrathecal infusion. For some other patients, it will be the mix of the IV, intraarticular, or intrathecal. Mesenchymal cells or stromal cells can differentiate into many cell types within the body. It's been highly proven and demonstrated with the last 10 years or even more than stem cells can differentiate into bone marrow, into bone cells, cartilage, muscles, neural cells, skin cells, etc. Stromal mesenchymal stem cells. In order to be called stromal mesenchymal stem cells, they need to fall certain markers. They have to test positive for some of them, and they have to test negative for some others. Like for example, they should test negative for CD45, 34, CD14, and CD11B. And 79, for example, but they also have to test positive for CD129 and some others we will discuss later on. But again, they can come from different sources. It can be either from bone marrow, deciduous teeth, adipose tissue, hair follicles, etc. But for us, in our medical experience, we've been on the market for more than 8 years now, and the way we perform it is obtaining it from, again, the layer covering the wharton jelly from cord tissue. Those are the youngest and most potent cells, for at least in our experience and research. Stromal mesenchymal stem cells, again, they have to cover certain markers of expression. They have to test positive for at least 95%. 95% of them must test positive for CD105, I'm sorry, CD73, and CD90. Negative for the ones I mentioned in the previous slide. And another thing is that these cells will have the ability to attach to the last layer of the plastic in the cell plate that we keep them in the bank. They will form a layer attached to the cell plate, and that's the place where we extract them once we are done with cultivating or growing the cells. Now, this image, sorry, this image right here is just to explain you where specifically we obtain these cells. This is the wharton jelly, and this is the part where we, the umbilical cord part where we obtain the cells. This cord layer right here covering the wharton jelly. Youthful cells also tend to replicate at a faster rate. That's the reason why we always use the cord tissue cells. And mesenchymal stem cells have the ability not only to differentiate into any cell type, but to multiply and increase the healing effect in the body. Okay, and as these cells obtained from baby newborns or from donated cord tissue are again the ones that have the best potential to replicate faster, multiply faster. The safety of the therapy, and there's a bunch of studies out there proving the safeness of the mesenchymal stem cells, because again, by their own, they're immunoprivileged. They do not cause any harm to the body, but completely the opposite. Mesenchymal cells are immunoprivileged. They do not cause allergic response. They have shown the ability to avoid negative response from a person's immune system, allowing the cells to be transplanted in a wide range of people. These transplants vastly increase the body's natural healing abilities and have potent anti-inflammatory and immunosuppressive response, which I've been stating for the last slides. Now, what we are aiming is, number one, regulating the inflammatory response and mediating the immunological response again to any condition or disease. Modulating the stem cells will modulate this process the best possible way, creating an osmotic environment and the best communication in between cells. So the reparative cells know how to start the process of healing the best possible way again. And the activity of the mesenchymal stem cells, for example, they will promote anti-inflammatory environment. And how they do it is by increasing or releasing regulatory B cells, releasing regulatory T cells, releasing regulatory dendritic cells, and increasing the M2 macrophages, which are the ones that increase lifespan and stop the process of aging, accompanying the opposite to M1 macrophages, which are diminished, as well as neutrophils, natural killer cells, and T cells and plasma cells. The point of using stem cells is always treating inflammation. When When we treat inflammation, we create the appropriate environment to help the cell to attach to the place where the inflammation is going on and start the process of regeneration. While stem cell treatment can repair damaged tissue and is relatively uninvasive because we can just provide it maybe with an IV or a couple of IVs or 3 IVs depending on your condition. The nature makes it more attractive alternative for anti-aging purposes because you don't have to do any surgeries or anything like that. It's pretty simple. Usually our patients do not complain about discomforts and they live pretty happy the clinic. They have also referred a bunch of improvements after receiving the cells, talking about anti-aging, which I will state in our last slide. The young nature of these cells allows enormous potential for them to transform into whatever type of cell within the body. The mesenchymal stem cells in 3 points. They reduce inflammation, they modulate the immune system, and they stimulate tissue regeneration. We must remember in summary that these are the 3 main things about mesenchymal stem cells. When administered intravenously, stem cells have the ability to promote a healing and regeneration by excreting messenger cells as well, which are the cytokines that I showed you in previous images, and vesicles like exosomes. So you don't have to put them straight in a specific area of the body. Of course, if you are complaining about wear out of your joints, we will put some articular application in the joint as well. Now, this image was kind of attractive to me because it shows a bunch of studies in different conditions stating that mesenchymal stem cells are pretty safe to use in humans with no risk of developing any side effects or attached conditions like cancer or anything like that. Our cells do not promote the growth of any neoplasia or causing any harm to the body. In conclusion, Dr. Barnhood stated in his last article that stem cell therapy in long term is a safe therapy. Mesenchymal stem cells also have a strong immunomodulatory effect, meaning they can prevent the immune system from mistakenly responding to incorrect threats. This can reduce negative immune response in patients with autoimmune conditions. Now, stem cells can help slow the process of aging and improve your quality of life. Stem cell treatment promotes self-healing and can slow the signs and symptoms of aging, increase energy levels and physical activity, improve memory and focus, meaning less brain fog, increasing libido, improve in their lab values when having issues with creatinine, for example, decrease blood sugar levels, improve lipid profile, decrease creatinine, and reduce appearance of wrinkles and age spots, as well as diminishing the amount of protein C reactive, which is a non-specific marker of inflammation, usually present in every patient who complains about any condition or in most patients at some age. Some cell rejuvenation is a type of therapy used to combat the effects of the natural aging process. A large amount of youthful cells are injected now into the patient via IV, and these are intended to replace the ones existing, meaning the old ones, to allow to the body to work in an efficient way by healing itself and reducing the inflammation. Keyword: inflammation. Hundreds of patients have undergone anti-aging treatment and have reported the following improvements with us here at the clinic, World Stem Cells in Rehealth. They have reported higher levels of energy, um, tighter skin, improved mental capacity, um, muscular gains, less joint and back pain as well, and less headaches, normalized functioning of internal organs, boost immune system, stabilize metabolism and hormone levels, better sleep quality, and improve libido. Overall, it is an improvement in quality of life. The advantages of our treatment are the lack of side effects, of course, which for me is the most important thing, meaning that everything is a win-win. No chemicals involved. The only things that we use for the growing the cells in the lab is the media and the antibiotic to avoid, again, the growth of bacteria. Minimal invasive procedure is intravenous and in some cases intraarticular or intrathecal. No rejection risk and no risk of developing cancer or any type of neoplasia. And we offer as many follow-up consultations as you might need. Okay? Mesenchymal consult. Mesenchymal stromal stem cells have the inherent ability to target inflammation within the body and repair the damaged tissue. You cannot live forever, but stem cell therapy can help slow and even repair the signs of aging. You must be aware that out there's a lot of scam therapies going around. Even in the US, there's a bunch of companies stating that they're offering stem cells. Look out for their quality. We have done several research looking out for the quality in their products, and you will not imagine the quality of therapy they're providing. And it's not to blame them, but they don't have the opportunity to work with the cells the way we do because FDA regulates the process and does not let them work with the cells at all. They cannot do a expansion or post-expansion or growth or separation of the cells. So the quality of the therapy will be maybe 10% compared to the quality of the therapy that we can provide here with all of our gear in our lab. Okay, so look out for the type of therapy that you're getting into your body. You want the good stuff, not the bad stuff, and make sure you do enough research before choosing to a specific clinic. We are completely open to answer all of your questions, any doubts at all. I'll be happy to assist you. I'll be happy to have as many phone consultations, completely free, of course, phone consultations to discuss any of your doubts related either to aging or to any other condition. You want control over your life, you know there's a better way to live and take ownership of your health, and you know that there's a safe and natural way to do it. Now, what will you do? We do not just provide stem cell therapies, we provide life-changing experiences. Remember that not everything that shines is gold, so do your research before choosing in a specific way. Thank you for your time, and I look forward to seeing if any of you have any doubts. I'll give a couple of minutes, and if not, write them down and whenever we upload this video, and I'll be happy to get back to each of you. Now, my name is Dr. Eduardo again. I'm the Senior Attending Physician at World Stem Cells Clinic. Here you can find our direct phone number, my direct email address, and again, we'll be happy to hear back from